Hi, everyone. As we have you logging in, we have a lot of attendees today, so we're going to give everybody 2 minutes before we get started. I know we usually see questions. As long as you can hear my voice, you are in, but we're just going to wait a few minutes. Tara, yes, participants are muted automatically. Kimberly, no, you are automatically muted. You should be good to go. Allison, you should not be seeing a video of yourself. That should be automatically off. There is not a video, but you should be able to see the PowerPoint slides, Melissa. Yes, everyone is automatically muted. So for those of you on the phone who are wondering why I'm chattering away, if you cannot see the chat, go ahead and click on the participants button at the bottom of your screen, and that will give you a chat option. Okay, everyone, the entries have slowly started to slow down, although they're still ticking in every couple of minutes, but we need to get started because there is a lot to review today. Just some housekeeping items before we really get started. If you hover at the bottom of your Zoom screen, you should see a sign that says participants, and it looks like 2 people. If you click on that, there should be a chat option for you. We're going to leave the chat open today for you to talk amongst yourselves. And so if you want to talk to each other, that's fine. There's also a Q&A function that's right next to that participants function. That's where we'll be pulling the questions from today. So if you have a question for Tammy, go ahead and put it into that Q&A function, and we will make sure that we get to it or that it's answered later. This meeting is being recorded. So please know that we will make this available to you. We will also make the slides available to you after the meeting. And if you have any questions, you can follow up with us directly, and we will make sure you are taken care of. So welcome again, everyone. My name is Renee Williams, and I'm the Executive Director for the National Center for Victims of Crime. Welcome to our 3rd webinar for the crime victims community in COVID-19. Just a reminder, we do push a lot of information out through our Facebook page and our Facebook group, which can be found on Facebook if you search Crime Victims Community in COVID-19. That's an interactive group that you can post in and send us questions, and we will do our best to answer them. We found that's a little bit better than bombarding everyone with email. Today's webinar, we're going to focus on the intersection between domestic violence and child abuse and COVID-19. We've had more than 2,600 registrants for this webinar, so I know it's weighing really heavily on your mind, and that's with due cause. Historically, in national times of distress, incidents of child abuse increase. This is especially true when there are additional stressors on families, such as anxiety about finances, health, and education. Dr. Nina Agarwal posted in a New York Times op-ed on April 7th that the COVID-19 pandemic has created conditions for a rise in child abuse that could go unchecked. And yet, despite this, we know that at state and local levels, reports of child abuse and neglect are down anywhere from 40% to about 70%. And that's been since the implementation of social distancing practices. This is probably, as we all know, because mandated reporters and especially teachers no longer have face-to-face contact and interaction with kids. And that's really scary right now because we know most K through 12 schools are going to be shuttered throughout the summer. With us today to talk about all of this is Tamara Chapman-Wagner, who is the Deputy Director for the Division of Children and Family Services in Cuyahoga County, Ohio. Tammy is an advocate for children and their families, especially those children that have been abused or neglected, and she has over 30 years of experience in child welfare and is an expert in the field of child abuse and neglect. She partnered with local treatment providers and other professionals to develop the program START, which stands for Sobriety, Treatment, and Recovery Teams. This program has gained national recognition for its successful outcomes at engaging substance abusing women in treatment while keeping children safe from harm. Tammy's been a public servant for most of her career. She recognizes the importance of partnership, both publicly and privately, knowing no one person or agency can be successful without their community partners. She serves on local boards, including the United Way Health Impact, Family Violence Prevention, and the Canopy for Child Advocacy Center executive team. Tammy's a graduate of Cleveland State University with both a master's in public administration and a BA in social work. We are so happy to have her with us to present on this crucial issue. Again, if you have questions, please use that Q&A function and feel free to use the chat as you would like. And with that, I will turn it over to Tammy.
Good afternoon, everybody. So to get us started, I think we need the next slide. Yep, okay. I don't think we can do introductions for all 2,600, but thank you, Renee, for that introduction. We're going to go ahead and start with some definitions. I think it's always important that we're on the same page with our understanding of child abuse and domestic violence. So child abuse is defined as any act or series of acts of commission or omission by a parent, caregiver, or another person in a custodial role that results in harm or potential for harm or threat of harm to a child. Acts of commission include words or overt actions that cause harm, potential harm, or threat of harm. Non-accidental injury or pattern of injuries to a child, damage to a child for which there is no reasonable explanation. It includes physical abuse, sexual abuse, emotional and psychological abuse. Next. Domestic violence has been defined as a pattern of behavior, not a single event, episodes that may become more severe and more frequent over time, resulting in an increased likelihood that the children eventually become victims. A pattern of assaultive and coercive behaviors, including physical, sexual, and psychological attacks, as well as economic coercion that adults or adolescents use against their intimate partners. So domestic violence is also known as intimate partner violence and family violence. The U.S. Center for Disease Control has defined an intimate partner violence as physical, sexual, or psychological harm by a current or former partner or spouse. This type of violence can occur between heterosexual or same-sex couples and does not require sexual intimacy. It can vary in frequency and severity and occurs on a continuum. Family violence, as defined by the Social Security Act, is family violence means conduct, whether actual or threatened by a person towards or towards the property of a member of the person's family that causes that or any other member of that person's family to fear for or be apprehensive about his or her personal well-being or safety. Domestic violence not only affects those who are abused, but it also has serious effects on those who witness it. Children who witness violence, who grow up in homes where domestic violence is present, are among the most severely affected. It not only predisposes those children to social and physical problems, it teaches them violence is a normal way of life. The pattern continues without intervention. It becomes more severe in nature and can often lead to death. So some of the similarities and differences between child abuse and neglect. So as similarities, both forms of abuse cross all boundaries of economic level, race, ethnicity, and religion. There are links to higher rates of intimate partner violence in the poorest of our communities. Both have existed for as long as time. Both have identified patterns. Neither are isolated events. Both occur with some regularity. Some of the differences: parental stress is often associated with child abuse, but not with domestic violence. So let's think about where we are right now with COVID-19. The stress our families are facing right now, they're experiencing higher levels of stress with job loss, strained finances, isolation from their support systems. They have added stress with the need to help educate their children. They're all wondering how they're going to get the next meal on the table, or where their job is at if they've been laid off. Is that permanent? Is that temporary? They're really struggling just to figure out how to provide for their family from day to day. They're isolated. We've seen similar instances when natural disasters have occurred, like when Hurricane Katrina and Hurricane Harvey occurred. Both were associated with higher rates of domestic violence and child abuse. During and after the hurricanes, Children's Hospital in Texas is already seeing an increase in child physical abuse presented to their emergency rooms. But as Renee said, our child abuse hotlines, our calls are dropping drastically. I haven't seen a drop like this, honestly, in the whole time that I've been there, which is over 30 years. So for the month of April, our calls have dropped 46%. That doesn't mean that children have suddenly not become victims of abuse. It's just they're out of the eyes and the ears of those that they would interact with, their teachers, their daycares, their social providers, their family members, their neighbors. There are also fewer resources and options for our children and families right now to provide support. Locally in our community, in my community, DV classes are virtually non-existent right now. We had a few classes that were available via web. All of those classes have filled up. There are no more classes scheduled until June, but yet I still have families that are suffering domestic violence that are not able to get the services and supports they need. Our local DV shelter has actually had to discharge some families to be able to maintain social distancing. Before, a victim may have been able to flee, go to a family member's home or a shelter. Now those options are really limited. And the victims are now at home with their perpetrator full time. Calls to our DV hotline used to really peak during working hours when the perpetrator would be away from the home. Now the call peaks are coming in the middle of the night when the perpetrator's asleep. At Children's Services in my community, we've had to add alternative ways to report child abuse. So we've added a Facebook link so they can private message us if there's a concern of abuse or neglect. They can email us. They can go to our website and do it confidentially through the web. And we've did those options specifically because we know that they might not be able to pick a phone up and talk to somebody, so their perpetrator would be able to hear them if they did that. But they have phones. Everybody's got a phone and they're connected that way. And so if they can get an email out, if they can get a chat out through Facebook, we can then respond to those calls. Next. The link between domestic violence and sexual abuse is pretty strong. Perpetrators of domestic violence and child sexual abuse seek to control their victims. They use verbal abuse and psychological control. They're really master manipulators. It's very much planned activities. Both believe their victim provoked the perpetrator's actions and they deserved it. So for example, they knew what they did. They knew there would be consequences. They knew that that action was going to provoke me or make me angry. They try to divide the family members against the victim. They really try to distract attention away from the abuse by getting everybody in the family to think negatively about the victim. They alternate between periods of kindness and love and periods of harsh abusiveness. So when you think about the cycle of violence, they go through these honeymoon phases and they're remorseful, often promising not to stop, but it continues to cycle through and we're right back to the abusive behaviors. Incest perpetrators are often harsh and rigid disciplinarians. There's a huge overlay of secrecy, don't tell, threats and consequences if they do tell that unfortunately are often carried out. Next. Perpetrators tend to be very self-centered and very selfish behaviors. They try to justify their actions. They see their victims as objects. You can't tell me how to run my relationship with my child. My wife is my property. They very much try to objectify their victims. They tend to try and blame a loss of self-control, that they couldn't control their actions. Their sex drive is too high. They were pushed to the limit. Their stresses in the home is what caused them to act out. They groom their victims by building trust. It's very planned, very calculated. It can take years to build trust. Victim is often the favorite, and sometimes you'll see the special attention being paid to that particular child because that's their favorite. That's their grooming behavior to build that trust. Many times they appear in the public in a positive light. If you go to do psychological testing on them, nothing is going to be earth-shattering on the testing. They're going to come out very much normal. It's really not mental health related in most instances. There's a high recidivism and a low ability to change. There's also a high correlation to substance abuse. Specifically in our sex abuse department, the children that we remove from the homes in that area, most of them also have domestic violence in their home. Victims who are both physically and sexually abused are more likely to be injured or killed than victims who experience just one form of abuse. When somebody does disclose, the perpetrator will try to discredit the disclosure. She's just mad at me because I wouldn't let her do whatever, fill in the blank. Or she was just mad because I caught her with her boyfriend and she got punished. They really very much try to discredit the disclosure or the victim by coming up with all kinds of excuses as to why they're making up these stories. The numbers are shattering. I mean, when you start to look at some of these, and I've only put a few on here, next slide, that really kind of highlights some of this. So when you think about it, nationwide, 30 million children are exposed to some type of family violence before the age of 17. 30 to 60% overlap of child maltreatment and domestic violence. And it just depends on which study you look at, but they're all in that range. 1 to 4 women and 1 in 9 men have experienced severe physical violence. In 2018 alone, 3.5 million children were the subject of a report of child abuse. Over 60% were found to be neglected, more than 10% physically abused, and 7% sexually abused. More than 15% were victims of 2 or more maltreatment types. More than 15 million children have lived in homes where domestic violence has occurred at least once. A batter of domestic violence is 4 to 6 times more likely to sexually abuse their child and 7 times more likely to hit their child. On an average, 24 people per minute are victims of rape, physical violence, or stalking by their partner. 93% of our child sex abuse victims know their perpetrator. 18% of female victims of spousal rape say their child witnessed the crime. So when you start to think about that, it becomes a normal type of behavior. It goes very much underreported because, one, their fear, the secrecy, the intimacy that happens within families, but often because they feel like it's normal behavior. Next. So when we look at the impacts that domestic violence has on children, it really starts in the womb. A mother who experiences domestic violence while pregnant is twice as likely to give birth preterm or to a low birth weight baby. And we all know the consequences that go with having a preterm baby or a low birth weight baby and the extra care that that requires. And then that is additional stress that puts on that family. Poor sleeping and eating habits for infants. There is also a connection to the impact on their development. Internalized and externalized behavioral, social, and emotional problems. Cognitive and attitudinal problems. Social performance issues. More likely than their peers not to be able to concentrate and therefore score lower on assessments and possess limited problem-solving skills. And so when you think about all of our schools are closed right now, we're not seeing some of these behaviors that would be the symptoms of the abuse that's occurring. And so our kids are really out of sight, out of mind right now, which doesn't mean the abuse has stopped. It just means nobody's seeing it. Long-term problems include substance abuse, suicidal tendencies and depression, inability to trust or bond. We also see high anxiety, high levels of depression that I talked about, and poor peer relationships. These kids are really very much isolated. Next. Okay, some factors that affect the impact of domestic violence on children. The age of the child. Really, the younger children exhibit higher levels of emotional and psychological distress. 5 and under actually may experience and develop regression. Frequency and type of violence exposure, protective factors and abilities, such as a supporting relationship with an adult, especially if the non-abusing parent can help protect the child from the adverse effects of domestic violence. And that's one of the biggest factors we use when we're assessing risk in a home, is what are the parents' protective factors. Social supports, male versus female. Boys exhibit more externalized behavior, aggressive type behavior. Girls more internalized, they become depressed and withdrawn. Socioeconomic factors and educational status. You know, our kids' risk levels and reactions to domestic violence really exist on a continuum. Some demonstrate enormous resiliency, while others show significant maladaptive adjustment. It really depends on the child and that home environment. Next. So how do we respond to domestic violence? You know, really to do it the right way, it needs to be a coordinated.
Actually, while we are waiting, because we do seem to have a technical problem and we can stop as soon as Tammy jumps back on. But if you guys can answer in the chat, because I am watching it pretty closely, what other issues can we be addressing as NCVC? I will give you all an update because I know many people have been on these calls and have been participating. We have done a letter to each and every congressman, which was senators and House of Representatives, to discuss the issues that we were seeing in tribal, in domestic violence, and an uptick in hotline issues, as well as shelter issues. But we're really always looking for things that we can make sure that we're bringing to the attention both of DOJ and of Congress. So what would you all like them to know if you had a chance to be in front of them? If you can answer into the chat, that would be awesome. So Michelle, the question was, if you could have Congress, if you wanted Congress or DOJ to know one thing that's impacted you or that you would like to have addressed while COVID-19 is going on especially, but just in general, what would you like them to know? So Sheila and all, I'm looking at your question that says internet access should be free to all. Is everybody seeing that as a big issue? I know a lot of times court systems have trouble because, you know, folks can't access the public library, which they can't right now because they're closed. Has that been a big issue for your clients? And changing subjects very, very slightly a little bit, how much has this affected your clients' abilities to get restraining orders, PFAs? Do they know that courts are open? Are they having trouble accessing them? Now, switching topics again, and by the way, so everybody knows we are saving all of these responses and we will review them and we will be trying to use them into a form that we can present so that we can make sure that we're advocating when we advocate for the right use of funds and things like that, even though we do not lobby, but when we're identifying issues, we can tell people what issues that we've identified. Folks who are in shelters or who are helping with shelters, do you see a downward trend in the use of shelters? Are people afraid to come and use them?
Hello, this is Tammy. Can you hear me?
I think we might be back. Tammy, you're back.
Oh, okay.
Welcome
So you can
back.
hear me. Okay, so you can hear me on my phone then. I'll do it this way.
Can.
All right.
Wonderful.
That's okay.
We assumed it was the snow. We are happy to have you back.
Oh my gosh, don't you love audio, all this technology? Oh my goodness gracious. I'm so sorry, guys.
It's wonderful when it works, but it's actually given us a good thing to talk about for individuals who can't afford technology or who don't have as good technology. You know, COVID's proven that we can do wonderful things, but that not everyone has the same access, and that we certainly can't take that for granted, that sometimes our clients don't have the same access. If we can go back one slide, there were some requests that I'm not sure where we cut off. So Megan, if you could just go back one slide.
And I can't see the slides, so just tell me which one you're on.
Right, so we're on responding to domestic violence coordinated response.
Got it. Got it. And, you know, Renee, you are absolutely right. We are finding over and over again that, you know, we've set up all these great technology for home visits to check on our kids and for parents to see their children and for family team meetings. And our families don't have that technology that we're assuming everybody has. And so they're still left out, you know, of those opportunities. And so it's becoming increasingly difficult to do our work and maintain social distancing, maintain safety of my staff. At the same time, I need to go out and make sure these kids are okay. So much of the work we're doing is still face-to-face contact, is still going into clients' homes because they don't have the technology, all of them, to connect the way that we do. So you're absolutely right. It's becoming a big barrier in that way. But when we talk about coordinated response, you know, so there's this push-pull between the domestic violence community and the child abuse community. And we have to really find a way to integrate our work more effectively because, you know, we all have our own missions and visions and goals that we have to reach, but We don't have to do it separately. We need to do it in a more integrated way. All of our providers need to share the same goals and values. We need to be able to focus on promoting and healing and preventing further trauma and work together to have a more coordinated approach to help eliminate the whole reasons for the trauma in the first place. And so when we think about a trauma-informed approach, we have to be very cognizant of the trauma that our families have already gone to and not add to that by having them retell their stories 50 times and, tell the police and tell the DV advocate and tell the child welfare worker. And where we can do that in a more coordinated fashion, they only have to tell their story one time. And we as the professionals work together to develop those service plans and get those response supports in to those families so that we're not tripping over each other or contradicting each other. They really need to see us being on the same page. The majority of the children in my agency and child welfare are kids who've experienced trauma, are kids who were exposed to domestic violence. We need to hold each other accountable as systems so that, if child welfare goes in and removes the child, we have to communicate that to our DV partners, because that's going to add additional stress and trauma to that family that they're going to have to help provide services for. So on the next slide, we talk about who's the victim. And really, I think this is where some of the struggles come in. As child welfare, the victim for us is always the child. Child safety is paramount. It is the reason we exist. For DV, it is the adult, the non-offending victim. And so there's a clash there sometimes. There's a struggle there sometimes because we're not always seeing the same person as the victim or the person who needs the service. DV programs often feel that child welfare punishes the non-offending parent by setting up a case, by removing their child, by bringing the courts involved. And child welfare believes that both parents have a responsibility to make a safe plan for their child. We just need to be cognizant of the unintended consequences to families when child welfare and DV programs respond separately to victims, and really make sure that we are aligned so that we're not sending mixed messages, and so the family doesn't see us as a non-unified system. They're already confused. They're already going through a lot of trauma. They're already got a lot of stress in their families. The last thing they need to try to figure out is, which program do I follow? Which recommendations do I follow? Which program do I go to? We need to do that for them. So then when we think about an integrated approach, when DV programs and child welfare really coordinate their responses, of course, there's going to be some risks and there's going to be some fears that each system has. So some of the risks are, will the rights of the child be taken over the safety of the adult victim? Will the adult victim be penalized if the child is exposed to domestic violence? That goes back to the whole parental's responsibility to keep their children safe. Will the adult victim's needs be overlooked? Will the child's voice be heard? Will services really address the needs of both the parent and the child? And will we jeopardize the child's safety in doing this? But these risks certainly stop our systems from working together in a more coordinated fashion. They need to be discussed. They need to be put on the table openly and seek some kind of mutual understanding so that a more coordinated approach can happen for the sake of the families that we service. I can't emphasize that enough. So what works and how can we help? And that's always one of the questions is, what can I do? And some of the ways that we can help is really to involve our community in a more multidisciplinary approach to providing intervention and prevention services, educating the public about the long-term effects of domestic violence and child abuse and the long-term costs to society. Provide access to self-help groups and other supportive services for perpetrators and victims and survivors of abuse. And like I said earlier, right now, I can't even get that service for my families. I mean, the COVID-19 has really put up huge barriers for our service providers because, they're risking their own health and safety if they do in-person meetings, and the technology is there, but it's not there for everybody. Providing education to those who work with children and families, including teachers, mental health providers, service providers about both domestic violence and child abuse. Encouraging your primary care physicians or your OBGYN doctors in the community to screen women for signs of physical and sexual violence and ask if they're in a violent or abusive relationship. I know my doctor used to do that a couple years ago. I haven't been asked that question since. So it seems like there's these waves of trainings that they go through, and it's on their mind to do that, and then it kind of fades away with everything else. We really need to be cognizant of signs and symptoms of abuse when our individual children and parents go to see their doctors. It's everybody can pick up on those cues. Work with our local schools and youth groups and any youth-oriented program to teach about healthy sexuality and healthy relationships. Most of those kinds of individuals are mandated reporters. I can't say it enough. If you see something, you need to say something. If you're not sure, it's okay. Still call and talk to someone on the hotlines about what you feel like is going on, what you've seen, what you've heard, what are the signs and symptoms, what's making you think that that child is at risk or that that parent is in an abusive relationship. Ask local and schools, universities to address the issue of sexual violence in their classrooms and through victim assistance programs. Ask your members of Congress to support funding for programs and to support victims of domestic violence and child abuse. I'm sure many of you have had some of the same experiences we've had this last year. VOCA funding was cut dramatically in our community. That's affected our DV shelters. That's affected our Child Advocacy Center. That's affected our rape crisis programs. They took huge cuts, and they've already been told to expect additional cuts this year. Volunteer at your local rape crisis center, state sexual assault coalition. Just get involved. Don't be the absent person from this, because it might not be happening in your family. Doesn't mean that it's not happening in your neighborhood or to your friends or to even family members that you might not even know about. Since we're all kind of isolated right now in our homes, the best thing that you can do is stay connected. And that may mean virtually, but we need to stay connected to each other and kind of keep our eyes and ears open for anything that doesn't look right or sound right. So I know you guys wanted a few minutes for questions, and I can't see questions, and I'm so sorry about all this technology stuff that happened today. I really apologize for that. I don't know if it was on my end or what, but I'm happy to try to answer questions if that would be helpful, or whatever you need.
So we did have quite a few pop in. So one of the questions is, what percentage of reports of child abuse come from school personnel? If you could estimate that.
Yeah, it's about 20%. And if we add daycares into that and after school programs, we're closer to 35%. So it's a huge portion of our referrals.
And then this is interesting. In Cleveland, if a child is born preterm or low birth, is there any type of outreach done to see if there was domestic violence involved for the woman? Is there any outreach done to the woman?
Yeah, I don't think that there's any outreach that I'm aware of specifically around domestic violence. Now, what they do is they link them to our Help Me Grow programs, who provide in-home supportive services, and they're all trained in abuse and neglect as well as domestic violence. And so they are good support providers that are aware of what to look for and know how to report and get the right services if they do see those things.
Okay, and then Megan, can you go back to the what works slide? So there's a question from the what works slide. Which of these suggestions is the most feasible during this pandemic, and which is the most efficient to implement today? And I will tag on to that. In addition to which of these suggestions and what works, what do you think works best? This is sort of part of another question. Is it punishing adults, encouraging reporting, or is it encouraging reporting? Or do you think it'd be more effective to be encouraging parents to seek help and seek resources?
100%, it's better if the parents can seek resources and supports and, keep themselves and their families safe. Absolutely. We never want to punish anybody for the acts that are happening in that home because, they feel so helpless, and the non-offending parent is really the victim as well, but it's just how the systems are structured and operate differently. During this time, this pandemic, we may be isolated, we may be working from home, or we may be doing things virtually, but that doesn't stop the conversations, and that doesn't stop the coordination of systems. I still have meetings regularly with my DV partners. We've got another one coming up to talk about this whole issue of DV classes and the fact that we don't have enough of a resource. That work has to continue. And so just because we're in the midst of this epidemic right now doesn't stop the conversations and the coordination of services for our families. We just have to be more creative about how we do that.
So here's another question, and I'll flesh this out a little bit as well. So the question is, could potential victims of child abuse be served by having some form of mandatory reporting established at supermarkets and other stores? And so I will say, so creating there are 16 states in the country, maybe 13, who have laws that say that every adult over 18 is a mandated reporter. And I have admittedly not done enough research to know if those work, if there are higher incidents of reports in those states, but do you think that those work? And do you think that such a thing is possible in the United States?
Well, I don't think you're going to get all 50 states to agree on anything, but I do believe that everybody should play an active role. If you remember when, I don't know, maybe not for you guys, but when I was growing up, your neighbors knew each other and you looked out for each other, and and people knew that who should or shouldn't be in the driveway or down the street, and what car belonged and what didn't belong. And so many people are sheltered now and isolated now that they're not really even aware of what's going on. I tell our training classes all the time, as soon as they get hired, when you go to the supermarket, your life is forever changed. The lens by which you see things and hear things is forever changed. So when you hear that kid screaming in the cart, you're looking around the corner to make sure that they're okay. But nothing stops us from taking that extra step and walking over to that parent and starting a casual conversation to see if they're okay, to see if they need some intervention, to see if there's a way that you can help. Not to accuse them of anything, but just to kind of check the pulse of what's really going on. I think child abuse and domestic violence are very underreported in our communities. The more affluent communities tend to deal with things much more privately than our impoverished communities. And so I would love to see more standardized reporting, but reporting is only about 50 years old in this United States before every state was even mandated to have reporting laws. So to get everybody to be a mandated reporter, it's going to take us some time, but honestly, I don't feel like there could be even enough mandated reporters. In Ohio, law enforcement has only been mandated reporters for a year. That blows my mind to think that our local law enforcement officers weren't even mandated reporters until 2019. But it's going to take a long time to get us all on that same page. But that doesn't mean as individuals that we need to not take an active role. And when we see something, to say something or to intervene and offer support.
And there are three actually right now that I'm looking at, kind of related corresponding questions. First of all, the National DV Hotline and No More have launched their campaigns Listening from Home to encourage neighbors and community members to report suspected domestic violence. We could say that parents have an obligation, absolutely, and should be mandated reporters to report domestic violence or child abuse of their child. And then children themselves, not as obviously mandated reporters, but who are reporting themselves. How much do we worry that any three of those people reporting put the child or the other person in even more danger, either because of retaliation or because the parent then becomes more violent?
Yeah, it's a huge concern. And you're absolutely right. That is one of the reasons why it goes underreported, is for fear of retaliation or fear of harm to happen to that individual. And that's why it's so important as systems that we do our due diligence to treat those reports with complete confidentiality, that we don't give away, whether directly or indirectly, who those reporting sources are. We even have a tagline on the bottom of our Facebook pages and our emails that says, is it safe for me to contact you, the referent back? And half the time that's checked no, please don't contact me, because we recognize that people are putting themselves out there and it might not be safe for them to do that. And I've had numerous people call me to say, please keep me anonymous, please. And we do that. You can absolutely report anonymously, and you can do that on the DV hotlines. You can do that on the child abuse hotlines, because we recognize that people are putting themselves at risk by speaking up. And so we have that due diligence as professionals not to divulge our sources.
Okay, last question, and I'm going to combine two again. How much of an increase do you expect to see in DV cases and child abuse cases once COVID ends? And do you know of any nationwide, any plans to address high-risk families at schools once the school year begins?
So, we're all bracing for this tidal wave. I don't know how much to tell you that we should expect. I know our DV calls are up across our DV hotlines, as well as our law enforcement responses. In the Cleveland area alone, our law enforcement has seen a 20 to 25% increase in domestic violence calls. Our domestic violence hotline has also reported an increase. But we are kind of bracing ourselves for when people are back in the public eye of what they're going to be seeing. We just talked and met with our local hospitals. We have 3 major health systems in the area to see if their EDs were seeing an increase of children being presented with any child abuse injuries, as well as any domestic violence going on in the home. And they're actually reporting the complete opposite, which is scaring them. And lack of people showing up to the EDs because such a message was sent, to not go because of COVID. Do not go unless you absolutely have to. So they're not even reaching, the emergency room departments. So we're really bracing ourselves. I don't want to throw a number out there arbitrarily because I just don't know. But when our calls are down 46% in the month of April alone, that's really, really scary to us.
Okay, well, Tammy, thank you so much. I know that we have a lot of questions both on the Q&A and I'm watching the chat still, so we are going to do our best to go over them. We'll send them to Tammy, and then we will also send an email out to everyone who registered today. Thank you again for calling in. Our next webinar is going to be how COVID is impacting our tribal communities, and we will have an expert speak on that. And before everybody goes, I know that Title IX and the recently released Title IX regulations are weighing heavily on everybody's mind. They are weighing heavily on ours too, and we are going to put together a webinar on that as well, just as soon as we figure out how to unpack it. And we will be posting the schedule for the webinars, both on that Facebook group, and if you signed up for today's webinar, you will be getting an email. Thank you all so much for calling in, and Tammy, thank you so much for joining us.
Absolutely, and I'm so sorry about the technical difficulties.
No, I think everyone knows that's coming these days.
Yeah. Take care, everybody. Stay safe.
Thank you, too.